How can I tell the difference between asthma, COVID-19, the flu, a cold, or seasonal allergies? Some symptoms are similar between these respiratory illnesses. This chart can help you figure out if you may be feeling symptoms of asthma, allergies, or a respiratory illness like COVID-19, the flu, or a cold. Respiratory illnesses may worsen asthma, so it's important to keep taking your asthma control medicines. If you have a fever and a cough, call your doctor. If you have seasonal allergies, there are things you can do to treat at home. Are people with asthma at higher risk of catching the new coronavirus? The data to date show no increased risk of COVID-19 infection or severity of COVID-19 disease in people with asthma. Are people with asthma at higher risk of more severe symptoms from COVID-19? There is no increased risk of infection or severe symptoms from COVID-19 for people with asthma. Should people with asthma wear a mask when in public areas? As more studies have shown that a number of people may have COVID-19 without symptoms, the experts around the world recommend that everyone wear a cloth face covering when in public to prevent spreading the virus. You can make your own covering from scarves, bandanas, or fabric. It also is still important to practice physical distancing. Wash your hands with soap and water often. Avoid people who are coughing/sneezing and have cold-like symptoms. Make sure you take your medicine and get your asthma under best control. Get the flu shot every year. What should people with asthma do if they have symptoms of fever and cough? Treat your asthma as your doctor has told you and give them a call. It is important to let them know about your illness. They will ask you a few questions about your illness that will help them decide if you should come to their office, go to the emergency department, or stay at home. If possible, and I encourage this, avoid going to work or any public places when you have a fever, so you do not spread your illness. If local clinics/doctors do not want people to go into a clinic sick, how will they know if they have COVID-19 or some other respiratory illness? If people get sick right now, but can't be seen for diagnosis, they may miss out on getting treatment. What should they do? In general, most doctors and clinics will look at the risk of the coronavirus and then decide if you should be seen in their clinic. If you are ill and they think you may have COVID-19, you will probably be told to go to an emergency department. On the way to the emergency department, avoid contact with other people and wear a mask if possible. Use physical distancing. Some people have concerns about the steroids in their asthma inhalers weakening their immune system. What should people know about inhaled corticosteroids or oral corticosteroids, such as prednisone? It is very important to keep your asthma under control. This often requires the use of an inhaled corticosteroid, also called a maintenance or long-term control medicine, that you take every day, and sometimes oral steroids like prednisone. Inhaled steroids are not a risk for people with asthma, so continue to take your medications as prescribed. Are people who take oral corticosteroids for asthma at higher risk of more severe symptoms from COVID-19? Older age, Black race, Hispanic ethnicity, high body mass index (BMI), and male sex are associated with the highest risk factors for complications, including death, from COVID-19. In data that looked at the use of oral corticosteroids, OCS, in people with asthma, they have no increased risk of COVID-19 due to OCS use alone. The risk increases if they have other high-risk factors, like high BMI. It is important to continue treatment as prescribed by your doctor. OCS can be life-saving treatment for asthma. Discuss the benefits and risks with your doctor. Are people who take proton pump inhibitors, PPIs, for reflux at higher risk of catching the new coronavirus? One study suggested there may be a potential increased risk of becoming infected with the new coronavirus, SARS-CoV-2, if you take a high-dose PPI twice daily, but a lower risk of infection if you take a low-dose PPI. The research was based on an online questionnaire subject to bias, so the findings are weak. Another study, which has not been peer-reviewed, suggests no difference in COVID-19 severity between people taking a PPI or not taking one. More research is needed to determine if PPI usage impacts infection rate or severity of COVID-19 disease. The current findings do not warrant any change in treatment for anyone using a PPI. Should I stop using nasal steroid sprays? You can continue to use nasal sprays. The risk of using them releasing particles into the air is low, far lower than sneezing. After using your nasal spray, wipe down the tip with a tissue. Throw the tissue away and wash your hands with soap and water for at least 20 seconds. Don't share your nasal spray with anyone. Should I avoid taking ibuprofen if I get COVID-19? According to the U.S. Food and Drug Administration, FDA, there is not enough evidence yet to know if ibuprofen and other NSAIDs, a type of medicine that reduces swelling, makes COVID-19 symptoms worse. If you are concerned about taking ibuprofen when you have COVID-19, ask your doctor if you can take acetaminophen, Tylenol, to reduce your fever. If I use a nebulizer at home, could it spread the coronavirus through the air, even if I don't know if I have it? If you need to take quick relief medicine, such as albuterol, for an asthma episode, use an inhaler, with a spacer, if possible. Using a nebulizer can increase the risk of sending virus particles in the air if you are sick. But if you have a nebulizer in solution, it is okay to use it to treat an asthma episode. When using a nebulizer, limit the number of people in the room or use it in a room by yourself. The biggest risk to people with asthma is not treating asthma symptoms when needed at home. This can lead to visits to overcrowded emergency rooms with no hospital beds. Uncontrolled asthma is a much higher risk to your health than COVID-19. Do antihistamines suppress your immune system and make you more likely to catch a virus or bacterial infection? Antihistamines do not suppress the immune system. There is no reason to think they would increase your chances of getting a virus or a bacterial infection. How much asthma medicine do you recommend people have on hand? I don't think having a large stash of medicine on hand will be helpful. And it will limit the amount of drugs available to other people. If you want to be safe, have a 30-day supply on hand. There is no need for more than that. If people receive their pneumococcal vaccine, does that provide any protection for developing COVID-19 pneumonia from the new coronavirus? No. The pneumococcal vaccine protects against a bacterial pneumonia, from Streptococcus pneumonia, but it will not protect against the pneumonia that COVID-19 causes. Should people with asthma have a pulse oximeter at home to check their oxygen levels? Can I use a health app on my phone to check my O2 when I'm short of breath? Pulse oximeters, or pulse ox, are used by doctors to measure how much oxygen your blood is carrying. Some people with COVID-19 experience a drop in their oxygen saturation in their blood. Many people with COVID-19 are using pulse oximeters at home to watch their oxygen levels even though they are not as accurate as medical-grade devices. Monitoring your pulse ox is not a recommended component of home management of asthma. In general, peak flow readings or keeping a symptoms diary are the most common ways to manage your asthma, along with an asthma action plan. A pulse ox may be added to this, but it is important to discuss this with your doctor. There are many ways home pulse oximeters can provide inaccurate readings. Normal pulse oximeter readings range from 92 to 100%, with 90% or below usually considered low, although some people have lower oxygenation levels normally. It is important to remember that the symptoms you feel should always come before pulse ox and peak flow numbers. There are no data demonstrating that monitoring your pulse ox through an oximeter or smartphone app will help manage your asthma. As always, talk to your doctor about the best ways to monitor your symptoms and asthma control. 6. Similarly, there is no recommendation to use an at-home pulse oximeter to determine if you have COVID-19. Doctors may recommend using a pulse oximeter to keep an eye on oxygen levels for people with confirmed COVID-19 and high-risk factors. Some people with mild to moderate COVID-19 may need to use supplemental oxygen at home. The CDC and WHO have stated that people over age 65 are at high risk. Are there recommendations for people over age 65 with asthma on how to avoid COVID-19 or other respiratory illnesses? What can you tell us about prevention or treatments for this age group? The recommendations are the same as mentioned above. If you are in the at-risk group, you may want to limit your exposure to public areas where many people gather. This applies to COVID-19 but also to other spreading respiratory viruses. I would also recommend not shaking hands, kissing people, etc. This will limit the likelihood of getting a virus from them. If possible, stay at least 6 feet away from anyone who shows symptoms of a cold, although many people with COVID-19 can spread the virus before they show any symptoms. What physical, social distancing, for example, staying home from work, school, large events and crowds, guidelines should people with asthma follow? Does the advice differ if you live in a town/county with an outbreak of COVID-19? What if you live in a state that is reopening? Physical distancing is always a good idea for everyone during the peak of cold and flu season, as well as during the current pandemic. This is a public health response to limit the viral spread. I would encourage everyone to follow CDC physical distancing guidelines, which is to stay home as much as possible, even if your state has reopened. This is especially important for people who may be at higher risk. It really is the distance between people that is important. I still recommend not shaking hands. And try to stay at least 6 feet away from anyone who shows symptoms of an upper respiratory illness. If your state is reopening and you need to leave home more often, for example, to return to work, talk to your doctor and continue to practice physical distancing. If for any reason you are entering an environment where you cannot stay 6 feet away from other people, please try to wear a mask that covers your mouth and nose. Also, be sure to wash your hands if you will be in an environment where you will be touching items that other people have touched, such as a store, etc. Is flying on an airplane with asthma safe right now, or should people with asthma cancel their trips? As businesses begin to open back up, employees may need to travel for work. It is still recommended that all travel, domestic and international, be avoided if possible. Physical, social distancing is still needed to stop the spread of the virus, so staying out of busy airports, train and bus stations will help. If you absolutely must travel, traveling in your personal car is probably safest because it's easier to limit the number of people you are exposed to. Remember that the biggest risk of getting any illness on a plane, train or bus comes from the people in the row in front and behind you, and those right beside you. I would recommend sitting in a window seat with an empty middle seat if possible. Ask to be reseated if someone in the row in front or behind or next to you appears ill. Think about bringing antiseptic wipes to wipe down your armrests, tray table, headrest, and other areas you will be touching. Wear a face covering as many airlines now require it. If you do travel internationally, keep in mind that you will likely have to self-isolate at home for 14 days. Or in some cases, you may not be able to even return to the US right away. Can I get the new coronavirus from a pet? Or can I give it to them? No one has been reported to have developed COVID-19 from their pet. However, the opposite has been reported, with a small number of pets, dogs and cats, developing COVID-19 from contact with people with the illness. The animals had very mild illnesses. For now, the CDC recommends you treat your pets like a member of your family. If someone in your home gets sick, keep the pets away from them just like they were a human member of the household. And don't allow them to be around people outside of your home. What are the best cleaning and disinfectant products to kill the new coronavirus when you have asthma? Products that clean, sanitize, or disinfect may trigger asthma. When using these products, open windows, run exhaust fans, avoid spraying them into the air, and wear gloves and a mask to protect yourself. If you can, have someone else do the cleaning while you are in another room or outside of the home. The Environmental Protection Agency, EPA, recommends the use of EPA-registered household disinfectants. When choosing a disinfectant, look for products that are non-scented. Also look for asthma-safer ingredients like hydrogen peroxide, lactic acid, citric acid, and alcohol ethyl or isopropyl alcohol. According to the CDC's How to Clean and Disinfect, clean surfaces first with soap and water to reduce the number of germs, then use a disinfectant to kill the germs. The things you touch often should be cleaned often, like tables, doorknobs, countertops, handles, toilets, etc. Follow manufacturer's instructions for cleaning keyboards, phones, and touch screens. If I make my own cleaning or disinfectant products, will they kill the new coronavirus? It may be hard to find a cleaning or disinfecting products in stores right now. If you want to use products you already have at home, try these. Hydrogen peroxide, 3%, can be used full strength to kill the new coronavirus. It should be left on surfaces for 1 minute before wiping. You can make your own disinfectant with bleach. Add 1/3 cup of household bleach to 1 gallon of cold water in a well-ventilated area or outside. Wear gloves and a mask, and do not mix other cleaning products, especially ammonia, with bleach. Mix small batches and throw away after 24 hours. Bleach can trigger asthma and is harsh on the skin, so use with caution. Wash your hands after using the bleach solution. That's it for this video. Make sure to like, subscribe, and share it with a friend if you found this useful.